March is Colorectal Cancer Awareness Month. Colorectal is the third most common cancer worldwide, but it is both highly preventable and survivable if diagnosed at the localized stage. Dr. Christina is the lead practitioner for Sarasota Center for Acupuncture and Nutrition. She's here to explain how natural medicine can help with your colon and gut health. Great to see you.
Oh, good to be here.
Gut health is a large encompassing area that really controls a lot of different things. Why is the health of our gut so incredibly important?
First of all, it is so very important to have colorectal cancer screenings. Let me just talk about that first.
Yep,
and
go
then
right
we'll
there.
talk about gut health, because you cannot imagine, you just have to be able to find that cancer early, and if you can find that cancer early, it is easily survivable, depending on what type of cancer, but most of them.
Right.
But it's about those screenings.
Okay.
So of course the gold standard screening is your colonoscopy. You know, you got to go in, you get the good drugs, you get that done, you wake up, you're like, what happened?
And everybody says it's not a big deal. I'm guilty, I haven't done it yet.
You should do it. Yeah.
And I'll tell you why in a moment. Well, because the Cologuard. We were going to talk about Cologuard.
Exactly.
So obviously colonoscopy is the gold standard. You mentioned Cologuard in our interview form when we were talking about things. Thoughts on colonoscopy versus Cologuard? Because this is a big debate.
It's not really a versus, right?
Okay.
Theoretically, colonoscopy has to be performed at some point, you know, I think it's over 55 now, unless you have risk factors in your history, right? Family member, colorectal cancer, you had something before. So the Cologuard is a good option for patients who want to sort of delay, or, you know, they don't really have a big history, that, you know, because there's a lot of false positives and false negatives, and so you have to be careful with those kinds of stool tests, but it's at least, you should do it at least.
Right.
If you absolutely refuse to do a colonoscopy, you have to do the Cologuard, you know?
Right.
And then if you absolutely refuse to do that, we can help you, because we specialize in gut health at our center.
Right.
And so what we use is a stool test that can show us inflammation and occult blood in the stool, which gives me a big push to say, you gotta go have a colonoscopy.
Oh,
so
that's very interesting. So if you're absolutely terrified of options A and B, which you shouldn't be, even I survived B.
Right.
To put it in a box. Long story there. It's so weird. But anyway, it was easy. You can do a screening and at least get the conversation going.
Yes. So we're putting ourselves out there as being people who do the screening, but this particular test actually does screen. So the GI Maps is a wonderful test. It looks at so many different things. So you talk about gut health. That's your immune system. We know that that's part of the brain now. It has its own brain, its own nervous system. We know the gut means everything from allergies to autoimmune issues, fibromyalgia. The gut health is everything.
Right.
So this particular test, albeit it is a stool test, but it doesn't need as much as the Cologuard needs.
Right. Or a box, probably.
It's a little baby box. Not a big square box. Anyway, so you have this test, and it's broken up into two sections. One is identifying bugs that are not supposed to be there, that are overgrown, whether it's bacteria, fungus, even viruses. And it's a PCR test. You remember that buzzword from COVID testing, right?
Oh, yeah.
Looking at numbers and quantifiable severity of issues. We're looking at numbers, not just under a microscope, looking for eggs, for parasites. We're looking at numbers of, if you have a parasite, how many millions do you have? How many hundreds of thousands do you have? If you have an overgrowth of a bacteria, if it's an inflammatory bacteria, it could cause reactive arthritis. You know, and then it looks at the other side of the test, looks at organs to support. Which organs are not doing their job in digestion? Is the liver, gallbladder not handling bile well and not digesting fats? How about the pancreas and its secretion of enzymes to digest? How about your stomach? Did you have an H. pylori infection, which causes not only peptic ulcers, but heartburn and acid reflux and GERD, right? And then what about the lining of your colon?
To the right place.
Yes.
Oh, I love
and we
this.
can fix things. We can. People come in with rashes. It's absolutely life-changing.
Because it shows you everything.
Yes.
So who should consider using this test? Anybody with any sort of discomfort?
Yes, bloating, really bad flatulence, farts, right? That are burning, you know, your eyebrows are singeing and the wallpaper's melting off the walls, and your
Things
spouse
aren't
or partner's
supposed
like,
to smell like that.
No, they're not supposed to be like that. A little bit of gas here and there is particularly normal, but not like that, and not excessively. Diarrhea and constipation, alternating, pain anywhere. Right? Difficulty swallowing, all these things, and you've already been down the gastrointestinal route, you've gone to the gastroenterologist and specialist, and here's your Pepcid and all that kind of stuff.
Right.
But you want to fix it. Here's your omeprazole. We don't want to take that forever, right? Those are short-term drugs. So let's come in, let's get it set up. We'll do a detailed history, we'll get the test done, and we'll have a roadmap to figuring out how to fix you.
This is what I love about natural medicine, because so many things, if you just look a little bit deeper, you can find other things to consider to solve problems, because that's what we're all trying to do, is solve problems and, you know, stay off pharmaceuticals as much as necessary. So gut health is important, but to repeat again, colorectal screening is a must. So remember, this is the month to get it done. Push your friends and family as well. And of course, when you have any questions about your health, you can always find Dr. Captain and her team at scansrq.com. We'll be right back.